intravenous devices and fighting melasma. Brigadier Negrasa is going to chair this session, so I invite him to come on the stage. Our first speaker in this session is Dr. Khalil Khatri from USA, and he ministers his experience on facial rejuvenation. I'll invite him. Please come.
Boston, dermatologist. He's been enjoying all the talks and all the demonstrations of different procedures. It's a very good conference. I'm myself learning a lot. I'm going to be talking about the facial rejuvenation. And since my focus is more on lasers, so I'll give a little bit of background initially, and then I'm going to be talking about the use of lasers for rejuvenation. These are my solutions. So if you look at this photo, this is what nature does to us. We're trying to reverse it and move our patient from this to this. How do we do that? Well, photo damage or intrinsic aging causes two kinds of issues in the skin, epidermal and dermal. And mostly epidermal damage is pigmentary, and the dermal damage is textural changes in the skin. How do we deal with this? There are so many different options these days. Surgical options are listed here. This is the lots of plastic surgeons in the room. They can tell you how to do that. Then we have chemical options, mechanical, and energy. So surgery, facelift, blepharoplasty, rhinoplasty, all kinds of things. For chemicals, we have peels, toxins, Botox, fillers, also PRP, which is not listed here. Mechanical dermabrasion, microdermabrasion, sanding, macro needling, rollers, all of these can happen. And energy-based, we can use lasers, we can use light-based devices, we can use ultrasound, we can also use radiofrequency. But the epidermal lesions, all the wavelength that's absorbed in the epidermal melanin can be used to remove pigmentary problems like freckles and seborrheic keratosis and things like that. We used Nd:YAG is 10 to 4 and 532. Alexandrite laser is 785. 755 IPL with a range of wavelengths. Pulse dye at 595. Diode laser at 810. And pico laser, which is a new device that's been used for these purposes. When we look into dermal, we can also use lots of non-ablative lasers. Virtually any laser device or IPL has been tried for that. And the newest laser is pico that's been tried. And then the mainstay is the ablative lasers, which is Erbium and CO2. So we're going to talk a bit more that in detail. If you look at the CO2 laser, the wavelength is 10,600 nanometers. Chromo 4, or the target is water. And it causes ablation and coagulation. It comes as focused and polymetric beam. We can use freehand or we can use the scanners. We get excellent results with that, but it's a long number. This is just to show where the water absorption is with CO2. It's right here with CO2. Initially, when we started using CO2 laser, it was CW or continuous wave. It was not a pulse laser. It was mostly used as a surgical tool and also to remove tattoos. With that, the skin temperature can get up to 200 degrees Celsius. You get charring and eventually scar. We tried to figure out how can we make these continuous wave lasers into pulse laser and avoid all those complications. So that we found out that if we keep the pulse duration less than the thermal relaxation time of the chromo 4 or the target, then we can avoid all those peripheral damages. This is one of my patients that I did a CO2 resurfacing, and you can see that she had a clear demarcation line, which is one of the problems with CO2 laser initially. So we tried to figure out if we can find a different wavelength that can get a better results or same results with less complication and less downtime. So we found this Erbium wavelength, which is 2,940 nanometers. From for still water, the pulse duration of the initial laser was 250 microseconds. It causes more ablation than population. What that results into, that because it's absorbed in water 10 times more than CO2, so you get an ablation and also get a photoacoustic phenomenon of that too. So it's causing more ablation, but no population. That means when we're doing the treatment, we see more bleeding with Erbium laser than with the CO2 laser. This just shows here where the peak is on the Erbium, here's CO2. You can see the absorption in water is a lot more Erbium than with CO2 laser. I published the first paper with this study at the Mass General Hospital. We treated one side of the face with Erbium yak laser and one side with the CO2 laser. And we found is that the residual thermal damage that the laser leaves behind with the Erbium side was 200, like the CO2 side was 200 microns, whereas on the Erbium side was 50 microns, and the fibroplasia was 200 microns with CO2 and 475 microns with the Erbium. And the improvement we found out that was excellent with 5 passes of Erbium or 3 passes of CO2. In terms of complications, we saw more erythema, edema, and hypopigmentation on the CO2 side, and hypopigmentation were about the same. This was the main difference here, hypopigmentation that you saw in the patient that I showed you, that a lot of CO2 patients were ending up with a permanent hypopigmentation. This is to show histology. This is the CO2 side, and you can see that the thermal damage that you leave behind after all that skin is gone. This is about 200 microns, whereas on this slide here is just a thin rim of this charred tissue, which is only 20 microns on the Erbium side. That's why the healing is faster on the Erbium side than CO2. This is the most important slide to understand. This is the CO2, this is the Erbium. Your depth of treatment is here. With the CO2, you're ablating this much. With the Erbium, you're ablating this much. This is the thermal damage that you leave behind, which you slough off that skin in the next few days. Whereas the Erbium is what you see is what you get. So this area is not going to be removed. That's why you have to do more number of passes on the Erbium to get to the same depth as CO2. This is a patient from our study. This is the CO2 side. This is Erbium side 6 months after. You can see the same kind of results, but this hypopigmentation that you see on the CO2 side. This patient, this side was treated with Erbium, 8 passes and 3 passes on the CO2, and you can see the same kind of results, but just a little bit of hypopigmentation on the CO2 side. For non-ablative resurfacing, and we saw that even with Erbium yak laser, we have some downtime and bleeding. We said, well, let's find out something else that can be workable. So we tried all the non-ablative tools, but the problem was if you look at the before and after photo, you don't see any results. So we gave up on that idea as well. Then we talked about this, if the fractional skin is treated with the micro beam of a laser. I remember I got a call several years ago at Rox Anderson due to Manstein, and Gregory Alshuter at the Palomar Laser Company. They asked me to come and join a meeting. When I went there, they told me about this basic concept of this laser. That they said we have done already the animal studies, ex vivo studies. We are ready to go and treat live patients. We need your help with this. And I joined the team, and we worked on it. And the rest of history, you can see how this creates these micro beams of damaged tissue. And this is how we replace new collagen here, and we get improvement. There's several devices that are used like this, but we still not getting the same results as we were getting with the later lasers. So we said, how about we combine the two technologies together with fractional laser and put ablation in it. So we are not just cooking the skin, but actually physically removing this. So if you look at this slide here, this is a non-ablative that is just warming up the tissue. This is full ablative that you can remove this quick. You can go as deep as you want. This is the 1540 or fraction laser. This creates this heated tissue. And this is the ablative fractional laser that can drill holes. And these holes can be as deep as you want, depending upon the energy that you use. I'm going to show you some of my patients before and after. This is before and 6 months after CO2 fractional resurfacing. Same patient, periorbital area and cheek. Perioral. A different patient. You can see how much not only the skin texture will improve, the wrinkles, the lines will improve, but the skin tightness that you can appreciate in this. And also we're treating the epidermal lesions at the same time. You can also appreciate improvement in upper eyelids. This is a patient who had full ablative resurfacing. This is before and 2 months after. I advised her to treat her whole face, but she said she was a singer and people focus on her mouth, so she only wanted to get her mouth treated. She was 73 years old, and I just treated this only 2 months after. After that, she moved to Florida, that's why I didn't see her, so I don't have any other problems. But you can see how much skin tightening you get. Not only the lines are better, if you focus on this area here, that we didn't even treat, but 6 months after you can see improvement in that. So much skin tightening that even untreated area get improvement. This lady is 54 years old, but she looks 80 years old. This is 6 months after full ablative Erbium laser service. Same patient other side. When I was publishing that paper that we compared Erbium with CO2 laser, when I finished writing the paper, I gave to Rob Sanderson. He made several edits, and at the end of the paper, he added this line with major variables in skin resurfacing of the patient and the physician, not the laser design. So it doesn't matter which laser we use. If the patient is right, if the indication is right, and the physician who's treating the patient is right, there's a lot more important than the variable itself. We already saw the results that you can get the same kind of results whether you're using CO2 or Erbium if you know exactly what you're doing if the patient is right. I'll show you one more before and after photo. Thank you so much.